Welcome to The Explainer. Today we're jumping right in to look at a pretty incredible report on the future of artificial intelligence in healthcare. You know, our health system is facing some massive challenges, and a lot of smart people are asking if technology might just be the prescription we need.
So to really get this, we have to start with a huge demographic shift that's already happening. By 2050, and that's not that far away, 1 in every 4 people in Europe and North America will be over 65. Now that's not just a statistic. What it really means is a huge increase in the number of patients who need complex, long-term care, and that puts an enormous strain on our health systems.
Okay, so just as that demand is about to explode, we've got another problem on the supply side. The World Health Organization is projecting a global shortfall of almost 10 million doctors, nurses, and midwives by 2030. Think about that. That is a massive, massive gap between the care we're going to need and the people who are actually there to provide it.
So when you put those two things together, what do you get? You get what the report calls a perfect storm. We've got rising demand from an aging population, costs that are just soaring, and a workforce that's shrinking and struggling to keep up. It's really pushing our healthcare systems right to the breaking point.
This is where AI comes into the picture. Faced with this enormous crisis, innovators and healthcare leaders are looking at artificial intelligence. And they're not just seeing it as, another cool piece of tech. They're actually starting to see it as a potential new prescription for our sick systems, a way to fundamentally change how we deliver care.
Okay, so let's be clear about what we mean when we say AI here. The European Parliament has a really simple, straightforward definition. We're not talking about sci-fi robots. We're talking about computer programs that can do things we usually associate with human intelligence, like analyzing an image, understanding language, or even predicting outcomes.
And the potential here isn't just one thing, it's everywhere. We're talking about the entire healthcare journey. It starts with the wellness apps on your phone, helping you with self-care. Then it moves to powerful tools that help doctors with triage and diagnosis, all the way to the back-end systems that just make a hospital run more smoothly. It's the whole shebang.
So what does this actually mean for the doctors and nurses on the front lines? This is a really, really critical point. The goal here isn't to replace people. It's all about augmentation. It's about giving our human professionals superpowered tools that enhance their skills and capabilities. And I think this quote from Dr. Eyal Zimlichman just nails it. He says, "In the future, AI will not replace clinicians. Clinicians who use AI will replace clinicians who do not use AI." I mean, that's it, right? This is an evolution. The future isn't about getting rid of doctors, it's about doctors who know how to partner with these new tools.
And let's get practical. Where does AI make the biggest difference? Well, it's not about automating surgery itself. It's about automating all the routine, predictable stuff that eats up so much time. For someone preparing medical equipment, that could free up almost half their day. And even for highly skilled people like pharmacists or surgeons, you can reclaim a huge chunk of time from that repetitive work.
And that's the whole point, isn't it? What do you do with all that reclaimed time? You shift the focus. You move away from the mountain of paperwork and admin, which can eat up like 70% of a clinician's day, and you put that focus back where it belongs, on direct, hands-on, face-to-face patient care.
Let's look at a real-world example. Diagnostics. You know how you usually get a blood test, they send it to a lab, you wait for days? Well, now there are AI-powered devices that can do a full blood count from a single finger prick in less than 10 minutes, right there in the doctor's office. That completely changes the game. You can get a diagnosis and a treatment plan in one visit.
Or think about chronic care, which is a massive driver of healthcare costs. You've got AI virtual assistants that can help patients at home. They monitor vital signs, remind them about meds, give them personalized advice. But here's the magic part. They can spot the early warning signs of a problem and alert a human doctor to step in before it becomes a crisis that lands someone back in the hospital. Okay, so all of this potential, it sounds incredible. It's a game changer. Which, of course, leads to the big question. If it's so great, why isn't AI everywhere in healthcare already? Well, it turns out the road from a cool idea to a trusted tool that's used every day, that's a really challenging path.
The report identifies 4 huge hurdles, and you'll see how they're all connected. First, you need quality and trust. The tools have to work, and doctors have to feel confident using them. But even the best tool is useless if nobody knows how to use it, so you need education and training. Both of those depend on getting good data, which is often locked up in different systems that don't talk to each other. And then, the big one holding it all together is regulation. We need clear rules of the road for how these tools get approved and who's responsible when something goes wrong.
And check this out, because this is really the bottleneck. When you ask investors what's holding back growth in this area, their number one answer isn't the technology, it's policy. They need an enabling regulatory environment. This just shows you how absolutely critical it is to get the rules right. Without that, innovation just stalls out.
So, here's where we land. The diagnosis is pretty clear. Our healthcare systems are under an unbelievable amount of strain. All the evidence suggests that AI could be a really powerful part of the treatment plan. It can augment our amazing professionals and make the whole system work better. Which leaves us with one final big thought. AI has offered a diagnosis for healthcare's problems. The prescription has been written. The real question is, are we ready to fill it?